And I was reading an article in the Ken which said that now like 1/3 of the women after marriage, they are doing that IVF treatment, and this number is increasing only. Is that
rubbish? This must have been a story planted by some PE IVF clinic.
Okay.
They all rubbish. Because fertility has not increased. Let me tell you that. Let me explain some things. Infertility has always been a problem through the centuries. Whether you read the Mahabharata, whether you read the Bible, it's always been about 10 to 15%, which means about out of every 10 couples, one is going to have a problem getting pregnant. Even if, for example, you may not know anyone because but if you ask your mom, she will know at least one person. Maybe your aunt was infertile. Maybe your but the trouble is you don't know because that side of the family dies out. But so it's always been common, ever. Now, the good news is we have treatment options. That's good. Part of the problem is a lot of what we are seeing is social infertility. What does that mean? It's not like there's been an epidemic of blocked tubes or egg problems or anything else. So a lot of these women are getting married late. Now, this is typically US problems or urban metropolis India problems, not necessarily typical across the board. But when a woman gets married late, a lot of these problems. Now, someone who got married at the age of 38, if she'd got married, if she'd been born 50 years ago, she'd mostly have got married at the age of 25, had a baby at 26, 28, and then not had a baby. Do you understand? So we're seeing an apparent increase, but I don't approve. Now, the trouble is, ye Ken wale story karenge, kisko interview lenge? Dr. Malpani. Dr. Malpani ko kya leading question puchenge? Dr. Malpani, have you noticed that the prevalence of infertility has increased? Obviously, Dr. Malpani is going to say yes. Loaded question. And Dr. Malpani's experience is irrelevant because, hey, guess what? I'm an IVF specialist. I am going to see more and more infertile couples. That's the nature of the beast. You're asking the wrong question to the wrong person. But anyway. But this is the story they sell to all these investors. So when all these Indira IVF guys will IPO, this is the story they will sell to all retail investors. So many infertile couples, so many potential markets for IVF, so many have never had IVF, and so many will need IVF.
But now, so tell me one thing, if there is a couple, now they are going for the IVF treatment and they really don't know that if the doctor is going to fool them or not. So how can these people know or get aware कि मैं सही जगह पे जा रहा हूँ, नहीं जा रहा हूँ? What are some things that they should check so that उनको पता चले कि first cycle के बाद second करना है, नहीं करना है, third करना है?
Excellent question. The rule is simple, and this is true for any professional, whether it's your chartered accountant, your lawyer, or your doctor. Don't leave your brains at home. You should trust, but you should verify independently whether what he's saying is right or wrong. Now, in the past, I would say maybe 30 years ago, I would say your only option was to get a second opinion. I would say maybe 10 years ago, I would say at least do a Google search. Not great today, but for various reasons, but at least that'll give you some more triangulation. Or at least or I would say go to a reliable website. Like if you get a website from Mayo Clinic, and you read the Mayo Clinic IVF website, that is not going to lie to you. I'm just giving you examples of what. Today, I would say go to ChatGPT, go to Perplexity AI. And the good thing is you can keep on asking these questions again and again. You can scan your reports. Am I getting the right advice? Is this making sense? So in fact, my first thing is your second opinion should always be ChatGPT. And this is not just IVF. This is true for anything, whether it's a law problem or a financial problem or whatever else. And then if you find, ye jo doctor bol raha hai, this is what global best practices are, you're sorted. Then stop using this thing. Then you should go ahead and do it. It's much better for good doctors. Good doctors actually encourage patients to find out information for themselves. I said it makes my life so much easier. Then I don't have to sit and explain, anda kya hai, sperm kya hai, embryo kya hai, blastocyst kya hai, main kya kar raha hu. Tum sab padh ke aa gaye ho, tumko sab kuch malum hai. Tumhari jo specific questions hai wo karo. So let me break it up. Bad doctors hate patients who ask questions. They'll actually insult these patients. Who's the doctor here? अच्छा तुझको इतना मालूम है ना तो तू डॉक्टर गूगल से ही ट्रीटमेंट ले तो मेरे पास terrible. So anyone says that, please walk out. That's a sign of it. If anyone gives you 100% IVF success rate with then go. Then forget about everything, which no one can do. But so I said that's one. Those are the bad doctors. Good doctors will answer questions, usually 2, 3. Then they start getting irritated. There's so much, so many, and even patients are reluctant to ask questions, quite frankly. We think the better doctors will actually create educational materials for patients and put it online. When a patient goes to my website, my marginal cost is 0. I've already produced it. If 100 log dekhenge, 1000 log dekhenge, mujhe kya farak padta. Our best model now is the digital avatar. Because even with the video, I have constraints. My English is good. My Marathi is terrible. The moment I do the digital avatar, all language constraints will then go away. And the trouble with a video, it's still a one-way thing. No? It's still, with the avatar, it's interactive, it's dynamic, you can ask. I'm very excited. We think entire healthcare will start getting democratized. See, now what happens is there are certain doctors who charge a premium and a brand name. So wait list is 3 months. तुमको अगर इससे अपॉइंटमेंट चाहिए तो तुम मिनिस्टर को फोन करो, अरे यार बॉस मुझे कुछ, it's ridiculous. And the worst thing is I actually don't think those doctors are very good. Partly because they built up a reputation, but they don't have time for you. When there are 40 patients waiting, how much time are they going to be able to devote to you? Whereas now, if I can clone that doctor and create a digital avatar of him, you don't have to travel to Mumbai to get his opinion. He'll give you that same opinion. You'll be sitting at home. Plus documented. I can lie in my clinic. I can say any rubbish I like. You can't lie online. But we'll see.
So if, let's say, all these patients, the potential IVF patients, they want to understand or know more about these kind of treatments and they want to educate themselves, what are like some 2-3 free resources for them that they should go to these websites or these YouTube channels where they'll get awareness about IVF?
Can I plug myself?
Of course.
We have drmalpani.com. Yeah. It's one of India's oldest medical websites. In fact, we've been telling doctors for the last 20 years, like I told you about the personal branding. I said the reason medical practice has become so corrupt is because of this middleman. The middleman is either the family doctor or the corporate hospital or the tout or whatever else it is. It doesn't matter. You have to cut out the middleman. And the only way to cut out the middleman is to go to where the patients are, and they're all online. So create your own website. So that's one thing which we've always said. So we've had Dr. Malpani now for 20 years. And it's evolved over the time, obviously. And we think that's great. It's great for me because anytime a patient asks me a question, I have to think. Because if one patient has this question, hundreds must be having the same question. Then I create a video which answers the question. I create a web page which answers the question. I create content around that. So that once that question is answered, it'll hopefully help 100 other people who will get that same information. So it's literally a one-to-many kind of relationship. And I think, the word doctor is derived from the word dossier, which means to teach. People forget that. Now, good doctors have always taught patients, but the trouble is you've only done it 1-to-1 because that's what your technology allowed. Now you have the ability to do 1 to 1,000. And again, people get angry when I say that, but I said, I think it's unethical for a doctor not to have a website. Because when you have the opportunity to teach patients in their own language as a trusted figure, why does a patient want to go to Mayo Clinic? They don't really care what's happening and they don't understand the brand names. They don't understand the English accent. They don't understand. They'd rather get the information from their own doctor. Now, if their own doctor is not providing the information, then they're forced to go somewhere else. No? And then doctors get irritated. कि तुम Google पे क्यों जा रहे हो? डॉक्टर साहब, अगर आप खुद की वेबसाइट करते तो मैं गूगल पे नहीं जाती, मैं आपकी वेबसाइट देखती और उससे मैं सब कुछ सीख लेती, तो मैं आपका भी सर नहीं खाती और मुझे मालूम होता क्या होने वाला है और क्या नहीं. बट बिकॉज यू हैव नॉट क्रिएटेड योर ओन वेबसाइट, यू आर फोर्सिंग मी टू गो टू अदर प्लेसेस. बट अगेन दैट्स जस्ट माय ओपिनियन.
Actually, the medical inflation, which is rising, which has been like 14%, and all these costs have increased. One of the main reasons is also because after COVID, like what has happened is that a lot of people who go to these hospitals or clinics, most of them have health insurance, and then they are like कि चलो कितना भी खर्चा हो वो हमारे health insurance में covered है. So what I heard from someone was that these health insurance were also, companies were facing a problem that कि इतने सारे hospitals से claims आ रहे, so they increase their premium which they used to charge to the customer. So ultimately what is happening right now is, like someone was telling me that कि retail individual जो है वो suffer करता है because hospitals charge more, insurance companies have to pay more claims, so that's why they charge higher premium to you, and this is like a cycle which is going on, and that's why the medical inflation is on the rise. So what's your thought on this entire health insurance versus medical inflation going about?
But I think what you're saying is absolutely right. That's the nature of the beast. The moment you allow someone like a private player like Adani to provide you with something like electricity, what do you think his interests are? He cares more about his shareholders, of which he is obviously the biggest shareholder, to maximize his ROI, right? His interests are aligned. That's the problem, the major flaw with the capitalistic system. You've got to acknowledge that. And that's why there are some businesses which should not be treated as businesses. And healthcare and education are definitely, those are public goods. The moment you start doing this, you're just screwing things up. And that's the one thing we've learned from the US. And that's exactly the way we're headed there. And the trouble is the writing is on the wall, and yet we're doing nothing about it, which is going to, things are just going to get worse. Like someone said, in India, you're just one illness away from bankruptcy. And it doesn't matter even if you're insured, because you think, हाँ चलो मेरा insurance है हो गया. But तो एक बार तुमने claim किया, तो next time तू पॉलिसी रिन्यू करने की कोशिश करेगा, तेरा प्रीमियम 10x हो जाएगा, वो एक्सेप्ट नहीं करेगा, 1000 चीजें करेगा. एंड द प्रॉब्लम विद इंश्योरर्स, दे एज बैड एज हॉस्पिटल्स, इज दे विल साइन यू अप, दे विल इश्यू यू द पॉलिसी, बट व्हेन इट कम्स टाइम टू क्लेम इट, दे विल क्रिएट 1000 प्रॉब्लम्स. नेम मैच नहीं होता है, ये नहीं मैच होता है, तुमने ये नहीं बजाया. द होल जॉब इज टू रिफ्यूज. इट्स अ मेस.
And I think I echo your thoughts about the kickbacks again, because I remember, so I had met with a knee accident, knee fracture and a partial ligament tear 4 months back, and the GP recommended me to go to this doctor who was in Breach Candy. And then when I went there, my 2 days bill was rupees 1.65 lakhs. And isme matlab actually it was a grade 2 injury, and there was actually no special need to get into an operation theater and perform a surgery over there, because we did not operate a surgery in the knee. मतलब knee के अंदर कुछ change नहीं किया. It was just a plaster जो लगाना था. They took me to an operation theater, and वहाँ पर मेरा पूरा ये plaster वगैरह गया. And when I saw the bill, so the surgeon fees were rupees 50,000. I was given an anesthesia which was rupees 15,000. OT charges were separate, I think around 5,000 or 10,000. I was just seeing कि ये करने का सिर्फ यही cost is like crossing 60-70,000. And then I was like कि I don't know, I mean ठीक है insurance से तो मैं cover कर लूँगा, but the bigger point is that I don't know कि क्या सही है, कितना सही है, and me as a patient I just have to listen to the doctor now because I've been admitted to the hospital. तो मतलब ये सब भी होता है.
But you're right, but the trouble is this is not going to end well. Yeah. Beggars can't be choosers, and the trouble is we optimize. It's a bit like you go to a government office, बस मेरी फाइल हिलानी है. अच्छा तू तेरी bribe ले ले तो मेरी फाइल हिला. But the second order consequences are when your kids are going to grow up in this country. You paid a 5% bribe, tomorrow it's going to become a 50%. People don't think, all of us, and again, it's, all of us are, optimized for the short term. And I think that's what bothers me about hospitals, because patients are vulnerable. They come to you in the time of need. Then instead of behaving like a professional who has their best interests at heart, you've actually scalped them. There is actually, I think there's a Jewish religious book which says when doctors die, they will all go to hell.
Oh my God.
Doctors, when they die, will go to hell because they make a living of other people's misery.
My God.
Again, you'll have to Google it to find out exactly what. And sometimes I think some of them do deserve to. But okay, sorry.
No, what's the name of the book? Sir?
I'll have to check. I'll have to find out exactly which one it is. But I mean, there is people who think a little bit deeply about this stuff. And see, I think the trouble with medical technology today is your power to do good has increased so much. Yeah. Your power to do bad has increased disproportionately. That's the problem. Huge.
Yeah, I agree. And any other scams or maybe any other things that people or patients should be aware of when, let's say, they are going for an IVF treatment, or anything else they should keep in mind?
So I wouldn't even just say IVF. So just to give you an example, many years ago, we started India's first patient education library. Let me explain to you why. I've realized there's no point in talking to doctors. Good doctors are good. You don't need to tell them anything. And bad doctors aren't going to improve just because you tell them anything. They know where their bread is buttered. They're not going to improve. So forget about it. So we said, let's focus on educating patients. If we can help the patient to differentiate between a good doctor and a bad doctor, everyone is happy. The patient is happy going to a good doctor. Bad doctors का धंधा कपट हो जाएगा because कोई उनके पास जाएगा नहीं, और good doctors का धंधा बढ़ेगा. So that was our focus on patient education, which is why if you notice my common theme throughout, not just my education, but educating patients, educating entrepreneurs, educating at Apni Pathshala has always been that. We think that's the one thing which can make a difference. And that's what we say, and which is why, so we had this library called HELP, or the Health Education Library for People. And if I can do a second plug, we have a second website called thebestmedicalcare.com. Thebestmedicalcare.com has 5 books, all of which we've authored, which are basically, so one set of books is for doctors on how to have a successful medical practice. And the message is simple. Take good care of your patients, and over time, everything will fall into place because you're playing a long game. We have a book called How to Get the Best Medical Care. We have a book called Patient Advocacy. What does that mean? How does a family member or someone else help someone else who's in trouble? We have a book called Medical Gobbledygook, which means doctors use jargon. How do you demystify some of that jargon and don't allow this thing? We have a book called Information Therapy, and we have a book on patient safety, preventing medical errors. So in fact, one of the things I do these days is I go to JJ Hospital once a year and I get invited to give a talk to the incoming medical students. That's what we're trying to tell them. Stop learning only from your medical textbooks and your libraries. Of course, you need to pass exams. I'm not stowing. But if you learn from a patient, what you will learn will remain with you for the rest of your life, because that you will always remember, yes, I treated this patient. This is what happened. This is how that, and then you read around that patient, that will always remain a part of your life. So we try, but the trouble is Dr. Malpani is a dinosaur. People will listen to the lecture, but they'll promptly forget everything afterwards.
How do you differentiate between a good doctor and a bad doctor? One thing you said that कि अगर वो बहुत irritate हो जाता है अगर तुम लोग सवाल पूछते हो तो that is a bad doctor. What are like other traits of a good versus a bad doctor?
I think that's easy enough. A good doctor respects a patient. A good doctor is punctual. If a doctor is running late, he will tell you why he's running late and apologize for it. A good doctor is transparent about his fees. He will not give you sticker shock. Halfway through the surgery, अरे surgery complicated है और 50,000 दो नहीं तो मैं surgery stop करने वाला. And all this is well known. You know what the irony is? It is these brand name doctors who do all this rubbish and who continue getting away with it. And patients are actually paying these doctors cash under the table because the doctor is demanding it. And I said, you tell me, if a doctor is demanding cash under the table, obviously he's cheating the government. He's an unethical doctor. Why do you think he won't cheat you? But patients just don't have that. नहीं सबसे अच्छा डॉक्टर है, मेरे फैमिली डॉक्टर ने बोला बहुत अच्छा है, वो जो तो उसको कैश दे रहा है आधा वो फैमिली डॉक्टर ले रहा है. But just so many things. So I think the most important thing is transparency. And I think if that so we'll tell you in advance, this is what I expect to do. This is the things I'm uncertain about. This is what this thing. I would strongly encourage you get a second opinion. I would strongly encourage you go to this website. It may not be the doctor's website, but go to mayoclinic.com/falana. The best doctors will actually give medical journal articles to patients. Hey, this is a complex case. It's not straightforward. This is what we're trying to do for you. So good doctors aren't ashamed about sharing their ignorance. They're humble enough to know there's lots of things we don't understand. Yeah. And I always tell patients, boss, I'm a good doctor. I'm as well read as anyone else. But the reality is that the island of medical knowledge is small. The ocean of medical ignorance is vast. And that keeps on changing. So you just have to accept that. If you're comfortable, I'm a good doctor for you. If you're not comfortable and you want someone who's paternalistic, who will tell you do X, Y, Z, I'm not the right doctor for you. Don't come to me because you'll be unhappy. And if you're unhappy, I'll be unhappy, and that's not going to work.
Is there any platform where someone can go and we can get to know the honesty, integrity, or ethics of this particular doctor and all?
We're going to try that. It's hard to do. It's hard to do because it's hard to use a rating system. But I think it's doable. And at some point, people have tried. There were things called healthgrades.com and stuff. Some of this stuff is available in the US. The trouble is that there will always be bad players who will game it. Having said that, it's still a very solvable problem. Let me explain to you why. So for example, if you rate some Amazon ratings used to be gamed all the time. Now, if you want to rate something on Amazon, you need to provide proof that you bought the product on Amazon. You can easily do that. Then you can say, so at some point we will do this. It needs to be done. So we will have a rating service which is neutral, which is moderated. Because we don't want you bad-mouthing your other doctor because he's your professional rival. Yeah. You will only be allowed to post a comment if you can prove that this doctor has treated you. And if you can prove this doctor has treated you, please post your comment. We'll moderate it. Because sometimes things go bad, not because the doctor was bad. Shit happens. Yeah. Then we will ask the doctor to respond. In all fairness, it's a fair this thing. You shouldn't just allow a doctor to bitch, a patient to bitch and get away with it because his outcome was bad. And I think if we can balance it, we'll see. I don't know.
Fair. And what has been the most interesting or most memorable case for you in your career in the IVF treatment? Like you really enjoyed, or maybe you were very happy after the treatment was over, something of that sort, which you remember?
So I think every baby is a source of joy. So I'm not going to say one. It's like asking a mother, which of your kids is your favorite. So again, but to your point, so the ones I find very interesting, the ones who are technically challenging. people who failed 3 cycles in some other clinic because the diagnosis was missed. So there are rare conditions. There's one called globozoospermia, where the man is infertile and cannot fertilize his wife's eggs with IVF because he's missing something called an acrosome. Now, that's a well-known diagnosis, but the trouble is that the eye only sees what the mind knows. If you don't think of it, you're not going to figure it out. So stuff like that's what gives me joy. But in a way, I think that's unfair. So incidentally, a far better IVF doctor than me in my clinic is my wife. That's Dr. Anjali. She's much better, much kinder, the only reason patients come to me is when she's not there. So they settle from anyway. But having said that, so she's written a book. It's called Tries, Cries, Sighs and Lullabies. And the reason it's called that is that when you don't have a baby, basically that is what you're doing, right? It's cries and sighs. Then you make your attempts. Those are the tries. And then finally, when it works and you have a baby, it's a lullaby. So she's basically collected the most memorable stories of our journey, the emotional stories, patients who failed cycles, patients who finally didn't do IVF and adopted a baby. So I think there's so many complex interdynamics at play. I always tell people, the thing about infertility is it's not just a medical problem. It's psychological, emotional, and social. Psychological, because you're going through such major self-esteem issues. I can't even have a baby. Yeah. Emotional, because it affects your partner. You can't keep on complaining to your husband. Men are from Mars, women are from Venus. Every time you get your period and you cry, what is your poor husband going to do? And social, because at some point people, अरे 2 साल हो गए अभी तक बच्चा नहीं हुआ, and you kind of feel मेरे बाद जिसकी शादी हो गई उसके भी 2 बच्चे हो गए. Lots of stuff. So a lot of it is, like I said, the good thing about infertility is, to that extent, every IVF cycle is like every other IVF cycle. Eggs लो, sperm लो, test tube में डालो, embryo बनाओ, अंदर डालो. But to that extent, every IVF cycle is different.
And in your experience, like, what would be the age of the oldest person आपने successfully IVF किया?
So right now, the government will not allow you to treat women more than 50 right now. But actually, there's no cap. And so I can get anyone pregnant, provided they're willing to use a mix and match of third-party reproduction. What does that mean? If she's crossed, let's say 45, and she's become menopausal, her eggs have run out. But if she's willing to use donor eggs,
got it.
Yeah. So we have technological solutions for everything. But whenever a patient does a consultation with me, I first start off by saying, you have choices. You have non-medical choices and you have medical choices. So तुम अगर मेरे पास आते हो तो हंस के आओ. It's not like you've broken your leg. You're coming for selfish reasons because you hope to get something from here. So non-medical options, including not having a baby, and there's a difference between child-free and childless. Child-free is you're choosing consciously, you know what, I want to lead my life without one. They're very different. And adoption is an option. We actually tell patients register for adoption because usko bhi 4 saal lagte hain. A lot of patients get very angry when I talk about adoption. You're an IVF doctor, you're a specialist, we came to you for IVF, you're talking about adoption, does that mean we're going to fail? I said, no. I said, you should first have divergent thinking. Keep your options open. No one's going to force a baby down your throat. And if at some point you decide, you want to take your name off your list, they'll be very happy because there are 1,000 other parents who are waiting in line. So that's not a problem. So we first start with the non-medical options. We are emphasizing that this is elective treatment you take for selfish reasons. Then we say when you're making a decision, use your brains so you understand your choices, then listen to your heart. What is plan A? What is plan B? Prepare for failure. Because then the journey is an emotional journey. It becomes a little bit easier when you're prepared for some of the ups and downs. And then worry about the logistics. How much does it cost? This, that, and the other. Because if you spend time on the first 2 things, the third thing is very simple.
Got it. And what are like the solutions? Let's say now someone is not having a kid. One solution is adoption, as you said. The other is just like accepting the fact that you can't have kids. Is there any other solution to this?
So medical technology is excellent for a lot of this stuff. Okay. So then you actually go into doing diagnosis what the problem is. So sometimes the problem is so simple is that her periods are irregular because she's not producing eggs. What's called PCO. So you give her tablets and she can get. So I always tell people, if you can get pregnant in your bedroom, don't waste your money coming to me. It's much more fun in your bedroom, but give me a box of chocolates when you get pregnant. That's the only condition. But the point is that it's a stepped care approach. तो गाड़ी फर्स्ट गियर में नहीं चली तो क्यों नहीं चल रही? तुम उसको फर्स्ट गियर में चला सकते हो कि नहीं. अगर उसमें नहीं चली तो सेकंड गियर इज कॉल्ड IUI. you're increasing the chance of egg and sperm meeting. अगर उसमें नहीं चली तो it's good to know कि third gear option है, IVF है, but that should not be your first option. It's a final common pathway for lots of problems, but you should reserve it for when you've exhausted simpler alternatives. Lots of patients aren't happy hearing that. And then again, at some point I say, तुमको घाई है तो IVF करो, मैं थोड़ी मना कर रहा हूँ, पैसे तो तुम मुझको देने वाले हो. Why should I stop you from doing it? Yeah. It's just my philosophy is that if simple things work, then don't medicalize an issue. And quite frankly, I'm in that position where I don't do IVF for the financial income anymore. I do it because, hey, I'm good at it and I enjoy it. So I can afford to tell that. You know, a lot of doctors, perhaps when you're starting practice, don't have that ability to be able to say that.
Yeah. So. You are one of those rare people I've interviewed on my podcast who is like let's say like there is some sort of conflict of interest for you to say nahi karna hi chahiye, IVF karna hi chahiye, but you yourself being an IVF specialist, you are saying ki agar nahi zarurat hai to nahi karna chahiye, which is like so honest. And
but there are so many people who actually need it. Why should you do it for the ones who don't need it? First, marne ke baad upar jana chahta hu. I don't want to kind of, did something which is wrong. So I do care about the quality of money. Yeah. Honestly, I don't think just earning money, I think beyond the point how much money you're going to earn, what are you going to do with it? Yeah. I think if you earn it well, it's...
Yeah. Very, very inspiring conversation actually.
No, thank you. That's so kind of you.
Yeah. I had a daughter